Good afternoon and welcome to this sixth webinar in our series on healthy ageing. We've had a fantastic sign up to this event from a very diverse range of organisations and for different specialisms, so welcome everyone. For those of you who don't know me, I'm Alison Giles, Associate Director for Healthy Ageing at the Centre for Ageing Better. I'm a joint appointment with Public Health England, where I sit in the adults and older adults policy team. And this webinar series is a joint endeavour between our two organisations. We're joined today by three really great speakers: Dr. Aideen Young, who's Evidence Manager here at the Centre for Ageing Better, Tim Egan, Head of Delivery for Sustrans, Midlands and East Region, and Eve Holt, who's Strategic Director for GM Moving. Before we hear from each of our speakers, just some housekeeping points. We're live streaming this session on Ageing Better's YouTube channel, and the webinar will be available to view on demand immediately after we've finished the live streaming, and we'll also share all the slides after the event with participants. All live attendees, so all of you joining us today, are in listen-only mode. If you've got questions for the panel, please do post them in the Q&A box, which you'll find in the control ribbon at the bottom of your screen, or the top in some cases. You're also welcome to use the chat box function for any comments or responses that you have. And also, please do introduce yourselves to each other and sort of strike up discussion, conversation as we go through the next hour, because it's great for us to get a sense of what's happening on the ground and what's happening in other organisations. Please just make sure when you use the chat that you check that it's you're posting chat comments to all panelists and attendees, because I think the default is that it only comes to the panelists, and we want everybody to be able to see all of the discussion. And for those of you who are tuning in on YouTube, you're very welcome to join in the conversation by using our Twitter handle, which is #AgingBetterEvents. And my colleagues will curate any questions that you pose through Twitter and make sure that I can ask them of our panelists as we go through today. Just by way of background, today's webinar is one in a series of webinars that we're running in collaboration with Public Health England to explore the 5 principles of our healthy ageing consensus statement. And a link is being posted in the chat now to the statement for those of you who aren't familiar with it. The statement sets out 5 principles or areas for action that we believe taken together will promote healthy ageing. The theme of today's webinar is active travel, and whilst active travel isn't a principle in its own right in the statement, we believe it's a really important contributor to 2 of the statement's principles, one being putting prevention first, but the other being ensuring good homes and communities. So walking and cycling can contribute towards the recommended 150 minutes of physical activity recommended for adults each week, which are essential for maintaining functional capacity as we age. And Sport England have released new figures today which highlight how physical activity levels have decreased since the start of the pandemic. So it's essential that we look at all the ways in which we can encourage people to take up activity again, and active travel is a really important mechanism for that. But importantly, active travel is also really important to community life and to maintaining our social connections, which is why we've singled it out as something to focus on today. And at Ageing Better, we want to improve access and participation in active travel for people who are age 50 and over. And our 3 speakers today have been invited to give their insights into how we can do that. So first up is Dr. Aideen Young, Evidence Manager here at Centre for Ageing Better. Aideen's going to present some hot off the press findings of an evidence review that we commissioned to understand the barriers to active travel in the 50 to 70 age group. So over to you, Aideen.
Thank you, Alison. First slide, please. As Alison just said, as a little introduction, why are we interested in active travel at Ageing Better? because active travel, which we define as that walking or cycling on those commonplace journeys that get you from A to B, is one approach to increasing levels of physical activity. And low levels of physical activity are, of course, one of the main risk factors for the development of long-term health conditions that cause disability in mid and later life. And of course, one of our big goals at the Centre for Ageing Better is to improve disability-free life expectancy. And we want to do that by reducing the proportion of people who are physically inactive. And as you can see from this slide, the levels of physical inactivity decline very sharply with age. And of course, we're looking at the 50 to 70-year age group because we think that by acting, and affecting change in this age group, we can ensure that people have a better later life when they get there. Next slide, please. So, with a view to kicking off our work in this area of active travel, we've commissioned a team led by Sustrans to conduct an evidence review and then primary research to fill the gaps identified in that evidence review that's examining preferences for, barriers to, and past experiences of active travel. So what we're interested in knowing is, what are the overarching preferences of adults in midlife for active travel, and what are their attitudes towards and their access to and past experiences of active travel? What motivates them to undertake it, and what prevents them? How do behaviours and preferences differ for different groups of people? Are there trigger points that precipitate people starting or stopping active travel, and how do these differ for different people? And of course, what role does the built environment play in encouraging or discouraging active travel for people aged 50 to 70? And so today, what I'm doing is summarising the first part of the project, which is the evidence review. Right, I'm actually having trouble seeing the slides that are up on the screen at the moment. Okay, that's fine. So and this slide just shows the it's an analysis of some data that we had done recently from the Active Lives survey, showing the frequency of active travel by age group, total number of trips altogether, and those done by walking and by cycling. And you can see that for every age group, it's actually very low, but declines quite precipitously with age. So the evidence review is actually two reviews, the first on attitudes and the second on the built environment. So the first review set out to answer one main research question. So what are the psychological, social and cultural factors that are or might be antecedents of active travel in people aged 50 to 70 in the UK? And this includes issues such as attitudes, habits, barriers, anything that motivates you, your experiences, your preferences, and so forth. And this looked at adults aged 50 to 70, as I said. It comprised qualitative studies. Now, needless to say, and I'll come back to this later, the 50 to 70-year age cohort is not one that is commonly studied, and so a lot of the studies that were found might have been around about people aged 50 and over, or about people aged 65 and over. So there was quite a challenge in identifying whether or not there was relevant data in some of these studies, that could be identified as relevant for someone in the 50 to 70-year age group. And it did mean that the sample size was often lower than one would like. Next slide. The second evidence review was interested in questions about the built environment. And it asked the questions that you can see here. This review was concerned with quantitative studies and was looking at features and characteristics of the built environment that were associated with active travel. I should point out there that the environment review was concerned with people of all ages. It was not possible to find studies on the built environment specific to the 50 to 70 year age group. And the reviewers felt that aspects of the built environment that were conducive to active travel for the population at large would be relevant for the 50 to 70 year age group also. Next slide. So the findings of the first review, just as a quick summary, are that the physical and mental health benefits gained from walking and cycling were identified as the most important motivator for partaking in active travel. The health benefits were couched in rather general terms, such as, just getting exercise or losing some weight, rather than being specific, specifically designed to reduce the risk of developing certain health conditions. Enjoyment of being outside and enjoying the fresh air and being out in the world and being in your community was also a very strong motivator for participating in active travel. Although, interestingly, while being outside and enjoying the environment was a clear motivator, the concern for the environment, protecting the environment by choosing to walk or cycle, was not something that was specifically mentioned. Feeling of freedom, independence, and control was also very prominent in the data. This could mean independence from cars in terms of not having to worry about where to park, or being free from relying on lifts. For cyclists in particular, it meant freedom from traffic jams, being able to choose traffic-free streets of your choosing, and being able to lock up your bike wherever you wished. People also identified certain life events that were associated with being able to make a change in their active travel habits. Things such as moving or changes in the family structure, switching jobs and so forth. And there was also evidence of a deliberate choice to become more active upon retirement. Next slide. The main barrier to people engaging in active travel was a feeling of safety. Many people cited that they felt safer being in a car than on the street. And this related not just to both walking and to cycling. It could be related to the time of the day, being out after dark, or in settings that felt unsafe. Among people living in more deprived areas, participants in some of the studies described kind of the difficulties of environments where there were hazards or obstacles. And of course, that was particularly an issue for people with mobility needs. People living with a disability are in general less likely to regard walking or cycling as a viable alternative to getting into the car. Although even in the absence of health conditions or disabilities, as we saw, levels of physical activity decline with age. This can be caused by a fear of injury or of exacerbating health conditions, but it's also the result of self-ageist views, limiting views, that have people believing that they're too old or out of shape or, to exercise. There's also a big issue with prevailing car culture, in which travel by car is viewed as the norm, and that's very common among the 50 to 70 year age group. A lack of motivation, which is often couched in terms of not having enough time or of somewhere being too far to go to. And of course, there is, people mention the weather, which, and I couldn't resist including this little cartoon thing with that quote, which I will not try and say, which is that Danish expression that there's no such thing as bad weather, only the wrong clothes. And sorry, so now we're on to the environment. Now, there is good quality evidence from many systematic reviews that the environment has a significant role to play in encouraging or discouraging active travel among adults of all ages. Now, this can be classified into the three big areas that you see here. So the characteristics of places where levels of active travel are high are places that have supportive infrastructure, street connectivity, and high population density and mixed land use. Now, supportive infrastructure usually means walking and cycling paths that are physically separated from motorized traffic. And as we saw in the attitudes review, so this is the second review, as we saw in the other one, fear of traffic and the perceived risk of being knocked off your bike, those are key barriers to active travel. So supportive infrastructure with walking and cycling paths that are separated and segregated could help to address both the real and the perceived danger that's posed by traffic. Environments also that promote active travel tend to have street networks that are connected and that create shorter and more direct routes to destinations. And this means high density intersections, crossings, lots of crossings that are safe and easy to use, a minimal number of dead ends, and traffic calming measures such as low speed limits and good street lighting. And then, and this is part of the 15 or the 20-minute neighborhood concept, environments that promote active travel often feature high population density and mixed land use, meaning that shops, housing, workplaces, and other amenities are all close together. So journey distances are short. So that's a very quick summary of the evidence. And as I say, I think that they, although they're distinct bodies of evidence, and both conceptually and methodologically distinct, you can see how they kind of link together, how features of the environment are clearly related to a lot of the attitudes that people have, especially around fear or lack of confidence. Aesthetics also was an aspect of the environment that people talked about. The built environment was a enabler or a driver of active travel, and that would be related to the attitudinal themes of enjoying the environment and enjoying being out and about in the neighborhood. Now, so this is lots of good evidence. It was very clear, though, that there is a real paucity of evidence for the 50 to 70-year age group specifically, and particularly certain groups within that 50 to 70-year age cohort, specifically people of ethnic minority background, people in rural areas. And so in the second part of this project that Sustrans is undertaking for us, we are conducting some primary research, which has just is ongoing at the moment. And this is the sample for that primary research. So you can see we have a range of people from a different whole set of backgrounds. We've got included people from ethnic minority backgrounds, people with disabilities, people from rural settings and so forth, so that we can hope to get fill in some of the gaps in the evidence around those people's preferences and their barriers and enablers for active travel. So the evidence review that I've just summarised will be published in mid-June, and the final report, including the data from the primary research, will be at the end of the summer. Thank you very much.
Thanks, Aideen. That was brilliant. Thank you so much for sharing those insights and for translating the Danish cartoon for us, because I was struggling to work out what that was saying. We've had lots of really great discussion in the chat, and thank you for people who are sharing the work that they're involved in locally. It's really, really useful for us to be able to capture that, and also just to share amongst with everybody. We'll hold questions for now and just move straight to our next speaker, Tim Egan. Tim is delivery manager for Sustrans in the Midlands and East region, and he's going to describe how Sustrans have been working on the ground in Tyburn as a partner in the National Lottery funded Age and Better programme in Birmingham to deliver active travel projects targeting people aged 50 and over. So over to you, Tim.
Thank you, Alison, and thank you, Aideen, for having me and inviting me from the Birmingham office to talk about our work on the ground. So I have the difficult task. I could talk for about 10 days solid about this topic, so I'm going to try and keep it to 10 minutes and talk about our 2.5-year sort of project on the ground in northeast Birmingham. So firstly, yeah, a little bit about me. I lead our community, workplace and school engagement programs across our Midlands and East region. I did a sport and exercise and health science degree that finished about 20 years ago now. And the reason I did that was, I think, because of my grandparents and my dad's health. My grandma, my mum's mum, lived to 101. Yet my dad and my mum didn't have such good health. You know, my dad had a heart bypass in his early 50s. Thankfully, you know, that was super successful. He had type 2 diabetes, and unfortunately passed away at the age of 70. But yeah, three of my 4 grandparents lived to 85, 94, 101. And I suppose as a teenager with a dad with health issues and type 2 diabetes, it sort of, I suppose, has stuck with me forever. And that's sort of the driving motivation of why I joined Sustrans and why I'm interested in this field, really. So the first couple of slides, just to say, my email address is on there. There's a couple of links on there. Take a photo or screenshot because there's lots more reading about this subject and our work and the work of the Aging Better in Birmingham programme, funded by the National Lottery Community Fund and delivered by the Birmingham Voluntary Service Council. Next slide, please. I'm going to try and avoid saying next slide, please, as much as possible, but I've got quite a few, so I'll just try and nod and things. Before I talk about our age-friendly Tyburn programme, we also delivered a smaller piece of work to create some walking maps. We worked with local older people in the sort of Tyburn area of Birmingham to chat to them about where they like to go to, what would they like in a map. And we created 4 different maps, one for the whole sort of wider Tyburn area, and then also specific ones for Bromford, Castle Vale, sort of Pipe Hayes area. So those are downloadable from the the Aging Better in Birmingham website. And yeah, if you're interested in what an age-friendly or an age-friendly map might look like, co-created by local older people, you can take a look at that. So the Age-Friendly Tyburn project, the aims were to reduce social isolation or look at the impacts of the built environment on isolation, to support residents of Tyburn to increase their voice and give them a chance to sort of co-design solutions and trial some ideas. And then deliver a 5 to 10 year plan that could deliver lasting changes for the area. Tyburn, many of you are probably thinking, where on earth is Tyburn? So anyone who's got on a coach or driven on the M6 in between Spaghetti Junction and Junction 5, if you're coming south, you might have looked to the left, and there's an industrial area, and then there's housing areas. That's the area of the project that we worked in. We broke that down into sort of 3 different residential areas, Castle Vale, Pipe Hayes and Birches Green. These areas were quite different. And a point to make here is that whilst this, yes, is urban Birmingham, you have the M6 and routes to the M42 and the A38, large arterial roads. All of our recommendations, we would say, from in the report, are applicable to any town, city, or even village, some of the recommendations. So whilst this is on the ground work with local people specifically looking at this area, all of the conversations we had with those people and the trials and the learnings and recommendations coming out of this work could be applied to anywhere in the UK. The methodology we delivered is similar to a lot of Sustrans sort of methodology, how we work in community. So one is to sort of discover, get to know the area, get to know local people, work with the community, engage and then work in the community to develop ideas, and then with them sort of design and some trials. And that roughly was how the year one of the sort of 2.5 years project sort of went. We then looked at delivering some trials, trying out ideas on the streets, making changes to the area. And then we did monitoring around that, and we've written then a report, and we've tried to include sort of a legacy, so that it's not simply a report that sits on the shelf. Next slide, please. The first thing we did was auditing and community workshops. And we, our lead senior urban designer, Mark, did a lot of work examining the WHO guidance around age-friendly cities. We incorporated that guidance with Transport for London's Guide to Healthy Streets indicators, and created I suppose a bespoke audit tool. We went out on the street, did audit walks with local people, to assess each of those three sort of local areas. We also did mapping workshops, just next slide, where we sat around a table and got loads of post-it notes out, felt pens, and local people wrote on where would they like to go, where can't they currently go because of safety concerns. They literally said things like, people have been run over there, and we put had to put that down, and then look at that. The green crossing time's too short, there's barriers, there's lots of rubbish or things like that there, it doesn't feel safe through that path, all of that sort of thing, to really sort of get to know from local people what was sort of going on there. This is just an example of some of the elements of the audit. So it's looking at cleanliness, noise. We looked at noise pollution for the whole area. So please, if you're driving on the M6, go at 60, not 70 or 80, to help these local people. And we looked at other things around air quality. And just next slide. At the end of year one, we then created a really comprehensive report. So we took some of our own examinations of the area, looking at the evidence. So we did looked at casualty statistics along the main arterial roads. We looked, as I say, at noise, pollution, air quality data. And then we also took that audit activity with local people. And that's available to review on our website. Next slide. I'm then going to talk about then the recommendations. I'm just mindful of time here, so I'm just going to skip through. I'm just going to give a nod. So basically, to summarize our recommendations that came out then of trials, we've got 4 areas that we recommend should be looked at if you're looking to make an area age-friendly: road safety, connectivity, placemaking, and maintenance. On road safety, some of these points have already been touched on. We looked at crossing times. Some great work has been done on this by Living Streets in London as well. Evidence is that if the crossing wait is too long, people will just go for it, or will feel worried. We found that the green person time for a 3-lane road in this area was as short as sort of 4 seconds. When we first visited the area before the project began, we were on bikes. We couldn't get across on bikes on a cycle pedestrian crossing in that time, and that makes older people feel anxious. If you're in a mobility scooter or with a dog or with pushing a pram, all of those things will make that more challenging and maybe prevent you or dissuade you from going on journeys and linking up with bus services. Pavement parking, speed limits, other measures like segregated cycle lanes that have been touched on, and sort of low traffic neighborhoods where you prevent sort of through traffic in an area, are other things that came out of that road safety element. If you just skip through these, it's just show some photos of our work. delivering trials of closing roads, and some of the trials that have been delivered during COVID as well by Birmingham City Council. Trials to install seating and bollards to prevent pavement parking close to primary schools where a lot of older people will be picking up or taking their children. Placemaking is really important. I think there's something in the chat there around like meeting friends, or and sort of AD mentioned around the, you know, how nice is an area, if to put it, you know, very broadly, but also things like accessing toilets, seating. My grandma-in-law in a village near Loughborough, you know, is walking to the post office at the moment. That's her one outing that she does, and there's no seat between her home and the post office, and it's slightly uphill on the way back. So that's something that, you know, she's chatted about with my mother-in-law, you know, so those things really make a difference to active travel in local areas. We delivered longer term trials with local primary schools, trying to activate local green spaces that were maybe a bit uncared for, put in temporary seating. Big up to Lidl. We put in temporary seating outside Lidl there that had good responses. And we could plant those up and things as well. Wayfinding was also a really simple trial we did, and so just working with local people. If you just skip to the next slide, I think there's a couple of photos around that. So big up to Nina, one of our volunteers and engagement. She sent us that photo on her bike there on the canal, very close to Spaghetti Junction. It's a great canal, amazing industrial, you know, cycling under Spaghetti Junction is quite amazing. But the signage, she emailed us and said, the signage I helped create enabled me during lockdown to go on a bike ride, which was, you know, just fantastic. On the previous slide, we mentioned improved public transport. Local political leaders are campaigning for a train station to be reopened near Castle Vale, which we support and are within our recommendations. It's really, really important. A lot of people in this area said they never go to Birmingham. You know, they can't get there. There's the M6 in the way, the Aston Expressway. There's no local train or tram services. And finally, the area around maintenance. So if you just skip on to the next page, one of my favorite photos from the whole project, you know, just some local people doubled the width of a pavement in an hour or two. And that photo there, you know, you can see where the leaves were. You know, who knew that pavement was there? And now that has been included in local sort of maintenance plans. And it's really important that budget is put in for maintenance of our walking and cycling infrastructure. Big thanks to other local partners, Compass Support, the Community Environment Trust, who did a lot of that sort of maintenance and support and provided us with volunteers, and PC Mark Hodson. You might have seen him on TV, but we did some really interesting work around the West Midlands Operation Zigzag work, which is looking at crossings and safety and how they can enforce, you know, road safety and good driving standards on those arterial roads especially. So thank you for listening. I'm sorry if I've gone over slightly, but yeah, welcome any questions.
No problem. Thank you so much, Tim. That was really fascinating and lovely to see those photographs. It really brings some of the situations people face to life. We'll hold back on questions for now, and we will move straight to our third and final speaker, Eve Holt. Eve is Strategic Director at GM Moving and is going to describe the approach that Greater Manchester is taking to widen access and participation in active travel for the over 50s. So over to you, Eve.
Fantastic. Thank you, Alison. Thanks for the invite, and it's great to be part of this conversation today. So first of all, just to let you know what GM Moving is. So GM Moving is our Greater Manchester ambition to design moving back in basically to everyday life for everyone in Greater Manchester, into the way that we get around, into the way that we work and play. And given the scale of that challenge, we take a whole system approach, very much building a movement for movement, in which everybody, all people or partners across Greater Manchester can play their part. So just bearing in mind, when I share examples of the work and the leadership and the learning that's going on in Greater Manchester over the next 10 minutes, and when I say we, I really do mean we, as in a whole multitude of people and partners. This isn't about any one organisation, nor should it be, or nor could it be. So I'm going to share a few practical examples. On to the next slide. So this is our whole system approach. Academically, it's called the socio-ecological model, which many of you may be familiar with, which recognises that there is no one sort of silver bullet really when it comes to living more active lives, or in this case, active travel for 50 plus age group, that really there's all these intersecting layers that all impact on whether or not we can actively get about, and we have to consider all of those. So in terms of what we're doing in Greater Manchester to help support this whole sort of culture change, system change, behaviour change, we're thinking about each of these multiple layers and the actions we want to take. So first of all, thinking about that top one, so cultural norms and ideologies, really thinking about how we share far more age-positive images, language, stories, communications that really help shift that culture away from thinking that when you reach a certain age, maybe walking, cycling, getting about in some other active way isn't for you. And this is absolutely key. So what we're doing is working with our partners across GM to share things like the fantastic assets, images that the Centre for Ageing Better have created and have their fantastic bank of, and creating our own that are obviously, Greater Manchester focus in terms of local people and local places, and really encouraging partners to make sure that they're using those, because we know that you can't be what you can't say. It's really important that people see images and hear stories that are relevant for them to help make this shift. Then moving on to the next key point, the next key layer. So thinking about policy. So it's really important that we co-design policy with people who have lived experience, are in this bracket of 50 plus, so they can bring their day-to-day lived experience to the policies and the strategies that we're designing across Greater Manchester, and that is all strategy. We are thinking about all policies, be that about transport, be that about our homes, be that about our planning, our health, because all of these impact on the way people get about, and on where they are going, and what their lives look like. So finding ways in which we can help convene people, using what we've got, fantastic GM Ageing Hub, which then has good relationships with the older people's network. We've got lots of fantastic age-friendly groups and networks across Greater Manchester, which are continuing to grow and connect. And what we do is making sure that we're reminding all our partners consistently that what we want to do is we want to involve them at the beginning of any process of designing policy and designing strategies, designing places, rather than just consulting at the end. It's involving them all the way through. And we've really seen this in Greater Manchester, I think particularly because of devolution, this real wish to work with people, to recognise that they should do nothing for you without you. It's about bringing people in and bringing their experience in. And one example of where we've been doing this around this particular agenda, we've had a working group set up to specifically look at active travel for those who are 50 and older, which has included the Greater Manchester Ageing Hub. Aideen has been supporting with all that fantastic data and insight that she was sharing earlier. So she's been part of that for the Centre for Ageing Better. Transport for Greater Manchester, Greater Sport, to our local active partnership, and the University of Manchester. So they've all been working together as part of this working group to really help pool that data and that insight to create a far more nuanced understanding of the very different needs of the population who are 50 plus. This isn't a homogenous group, as we know. That is a very wide span of ages, as Aideen was describing before, depending on your demographic characteristics, depending on whereabouts you live in Greater Manchester, depending on your level of income, that your life expectancy, your healthy life expectancy, all these other intersecting barriers to whether you live active life or not will really impact on you. So it's really making sure that our partners have a far more nuanced understanding of disaggregated data and how that intersects and interconnects. so that they can then absolutely use that to better inform what they're doing and how they're doing it. And we've seen that, so we're already seeing partners now ensure that, for example, their samples, their surveys are much quicker to include older cohorts and can be broken down so they get that more nuanced detail. Then thinking about the physical environment. So there was lots in what Tim has just shared, lots of examples that are very familiar to us in Greater Manchester. And I saw, in fact, there was some chat as well, which is great from colleagues, from friends and neighbours across Greater Manchester who are sharing some of those examples, like benches. So, you know, really, how do we ensure that we're creating these age-friendly neighbourhoods, which mean that it's far easier, it's far more attractive for somebody to go out and to be able to get about, walking, cycling, wheeling, and know that they can take a break, they can have a chat. So from benches to lighting, making sure we're getting rid of that pavement clutter, creating far more safe and green and pleasant public realm that people can stand around and chat. It's intergenerational, that they, you know, we know lots of our older population are caring for kids, for grandchildren. So how do we ensure that we're thinking about them when we're designing, for example, our parks, our public spaces, our services, so that they've got somewhere to go and somewhere that they can get to and want to get to in an active way. And then we're really making sure that as we think about our active travel, that we're thinking about travel more holistically in terms of how we get this integrated approach and what we call kind of the right mix that enables you to get about by foot, by bike, by any mobility aid, and to be able to then also travel on, move on your journey by public transport in a way that's accessible for you. So getting that whole integration is absolutely key, and I'm sure some of you will have seen that in Greater Manchester, part of that is thinking about how we are reclaiming ownership of our buses in order to have greater control, how all of that interconnects. And things like those signs. So in my other hat, I'm a councillor as well. I'm absolutely delighted that our neighbourhood officers have just agreed we're going to change all of our street signs in our Lakewood neighbourhood to those fantastic sign that you can see there. It's a far more age positive sign. So those little nudges around the community that say this is a place absolutely that is age friendly and that really encourages people to think about how they use that space to be active and to enjoy the joy of the journey. So next one, in terms of organisations and institutions, I've already mentioned quite a lot of key partners that we're working with, from Transport for Greater Manchester to our Greater Manchester housing providers, the Ageing Hub and others, in really thinking about how we come together and convene in order to take that whole system approach to enabling more people to actively get about. And we're doing this through a whole host of going to them and of convening specific spaces and sessions that are both big and small in order to have these conversations and encourage everybody to weave it into their agenda, to weave it into their work, to recognise that they have a responsibility to take action to support this agenda, and equipping them with both the data and the knowledge and the insight and the good practice and the connections and networks that will enable them to absolutely do that. So just by example, we're now convening a quarterly, what we call big active conversation, which is we're convening with Transport for Greater Manchester and other partners, including the sort of walking and cycling alliance partners like Sustrans, for example, in order to hold these spaces that are absolutely open to officers, to elected members, to members of the public, to key partners, to come together and to share some key insight, just as we're doing today, but really have a kind of a space of participation and to be able to dig in. And it was great to have, we had over 300 people at our first one of these events back in March, which was specifically talking about widening access and participation in active travel. And our next one, which is in June, is going to be thinking more specifically about the active design role in that and how we share best practice in Greater Manchester. So moving on to social environment, we've heard a lot already about that importance of of the community connections that come actually by if you're able to walk and cycle and get about in a more active way locally. We know that you're far more likely to bump into people, just pass those little smiles, the little waves, those little interactions that are absolutely really important to our sense of belonging in a place, our sense of well-being, and that sort of informal social care. So we're really paying attention to how we design for that social connection, and we help grow social networks and community connections and spaces that will better help create the conditions for people to be able to walk and cycle and to have that kind of buddying, that peer support. So whether that is walking groups, our Greater Manchester, we've got a GM walking sort of focus stream of work, which includes funding for community groups, quite some of them very, very small, who maybe never consider themselves to be a community leader or a big walker, to set up and to encourage each other to get out and walk about. And then the same with our key cycling partners like Sustrans and Cycling UK, etc. And then really this last point around how we just make sure that we're conscious about active equipment. So what some from the very practical things, sometimes it might be the tyres on your bike, it might be what kind of bike, it might be storage, but also it might be the tyres on your wheelchair or mobility aid that help you live a more active life. And then just finally, just really making sure that we're consistently applying this inequalities lens and really encouraging all our partners to recognise, as I said before, how it intersects with those other inequalities. So about to wrap up, the next slide, just to say all of this is then considered as part of what is the first and last step as part of an integrated transport network, which we call our network, and make it recognising, you can move on to the next slide, that it's, as I said before, it's, the public transport is really key to then supporting active, sustainable travel, and also thinking, as Tim referred to, about placemaking as a whole. People are only going to walk and cycle if there is somewhere within a reasonable distance that they want to go to. So access to green spaces, access to shops and services that absolutely meet their needs in a local place, taking ingredients of like a 20-minute, 15-minute neighbourhood. So thank you, and I look forward to our questions and discussion.
That's brilliant. Thank you so much, Eve. If I can invite all our panelists to come back on screen. We've had some interesting questions come through. Actually, I'll ask one to Eve, seeing as you've just finished. A question from Julia Thrift. Hi, Julia. Many of the things that make places age friendly are provided by councils and are exactly the things that councils have to cut when money is short. How are the Greater Manchester councils funding the sorts of interventions that you've described?
Yeah, it's a very good question, and it's a very real challenge, isn't it? There's a whole mix of funding for things I've described there, because some of those sit absolutely with council budgets. Some of those are things that we've been able to fund from a kind of a Greater Manchester pooled funding. Obviously the B network there, for example, in terms of kind of the hard infrastructure changes that we're making Greater Manchester to reallocate space for walking and cycling have come from the Mayor's Fund, as well as coming from some of the funding from central government, which then have been distributed, either to localities or held centrally. And then there are we're constantly looking for other opportunities to access, additional funding to help maybe trial and test at a more local level. And as we know, some things aren't high cost. Obviously, creating new cycleways are, putting up signage, some of these things, clearing paths with volunteers, some things aren't high cost and could be high impact.
Thanks, Eve. A question from John Preston, which I think I'll ask to Tim, if that's all right, Tim. Should there be powers to enable the missing links in path and cycleway networks to be created? It sort of relates actually to Eve's point there. Current networks often don't reach the destinations that would encourage more cycling, etc. Does Sustrans have a view on that?
It's a big one, that, isn't it? So Sustrans are custodians, for example, of the National Cycle Network, which is about 13,000 miles. And yeah, land ownership is a big challenge for my colleagues who work in that area. And funding is a big issue, and then legislation as well. So, absolutely, legislation, funding matrix, all of that, needs to be looked at. The reality is a charity is a custodian of a national transport network. I don't think that's the case for our, air network or our train network or our road network. So, of course, we need to prioritize it more. And we have a sort of 20-year plan to make the national cycle network, high quality and suitable for any 12-year-old to ride on unaccompanied. Just linking back into the funding question, though, as well, it's around cities as well, looking at, yes, we call on the Department for Transport to increase funding for walking and cycling, which they have committed to and has happened. But also, for example, Nottingham with the workplace parking levy, which has been super successful and is now being considered by Cambridge, Leicester, Birmingham and other cities. That ring fences that income for public transport and sustainable transport. £500,000 of that fund has gone into, bike parking, cycling and infrastructure. So, a bench is cheap. Clearance of a path is really cheap. Putting in a dropped curb is super cheap. So it's about just reprioritizing the funds that are there, and also local authorities can look at their own funding sources locally.
Thank you. Thanks,
definitely,
Tim.
yes, there should be powers. Yes. I don't know, superpowers.
Yeah, that's great. Thank you. A question for Aideen, because I think this has come up in some of our discussions. So, question from Kate Mooney about advances in technology causing barriers potentially, or maybe less of a barrier, but she cites the example of motorized scooters, perhaps enabling people to avoid active transport. But we have talked internally about electric bikes, haven't we, potentially being a great thing to get people more used to cycling again. Aideen, do you want to comment on that? And is it something that maybe we will be exploring in the qualitative work that we're kicking off?
Yes, I think that e-bikes, and there is something in the review actually about e-bikes. E-bikes are a very good thing. But they're costly, obviously, so that's going to be a barrier for people. But there's evidence of there is an increasing trend towards e-bikes, and could be particularly beneficial in our particular age cohort because it helps with managing hills and long distances. We will be exploring attitudes towards e-bikes in the qualitative research. It's also interesting, the e-scooter phenomenon, because because of the fact that all of this active travel is so inextricably linked with public transport, you sort of think maybe even e-scooters could be linked with bits of walking at the beginning and end of a journey, and in that way could be associated with increases in active travel. They also could perhaps act as a gateway to more active travel by just simply getting you out of the car. That could be. These e-scooters and e-bikes could be a way of getting people with, say, disabilities or long-term conditions who think otherwise that they can't engage in active travel. It could be a way to get people, to take that step. So I think there's some interesting possibilities actually with e-scooters and e-bikes. E-bikes I think are sort of obvious because you're still on a bike, you're still cycling. There's definitely active, it's still active travel for sure, and you can just go further and you can navigate hills. I think e-scooters are interesting because you don't seem to really be doing anything. I don't know if they count as active travel, but it could be that with the bits of journeys at the beginning and end, and it could be that they act as some sort of gateway, possibly.
Thanks, Aideen. I don't know, Tim, is it something you'd want to comment on?
Best is just Google Sustrans e-scooters. We have a really good statement on it, but they are everywhere in Birmingham. I'm going on the school run at 3:00. I'm going to see a load of them in South Birmingham. But the evidence, and why I say Google that is because it looks at the pros and cons. If you're an older person walking to the shops on the pavement and somebody comes along on an e-scooter, that may give you feelings that make you less likely to want to walk for the local paper. And do they actually replace car trips, or do they replace walking and cycling trips? These are the sort of that's why we need great academics like Egan to look at the evidence and do research on it. And so yeah.
Of course, you're not supposed to use them on the pavement, so that would have to be strictly enforced. They shouldn't be on the pavement.
And there are accessibility, somebody, you have to have a driving license to use one. So people that can't afford a car, people who might have a disability that means they can't drive, means they might not be able to hire an e-scooter. All of these things, aren't in place for an electric trike or an electric bike or a hand cycle. So so there's lots of things to look at there. We needed another webinar on it.
Yeah, great.
In Manchester has other thoughts as well.
Yeah.
I just jump in really quickly on that. Is that okay? Just because I think one of the things, e-scooters are highly controversial. I think a lot of that's been covered there for different reasons. In terms of e-bikes, I'm really pleased the Transport for Greater Manchester are developing e-bike hubs across Greater Manchester. And I think part of that as well is thinking differently about what kind of storage space and bikes generally, thinking about cycles more broadly rather than just having this image if it's one kind of bike. And I think that's really important. And just to share, I think is a lovely example in response to mutual aid. We've got a local group that in responding to that, and I know there's others actually in Birmingham and elsewhere that have taken to using e-bikes in order to deliver essential goods from local traders to residents who needed it. And we've got a local example that is now an absolutely thriving cooperative. And the majority of people who set that up, who are riding those bikes, are definitely over 50. So they're now in effectively it was initially a volunteer response, but some of those are now going to be employed. So again, it's shifting our, mindset as well around jobs and employment and what that could look like in living a healthy life actually through your work. And I think that's a very visible image of them suddenly cycling around, with this big bike full of stuff as an older person, I think is absolutely fantastic. So there's some great examples out there.
Thanks, Eve. I think one last question, which as chair's prerogative, I will ask. We sometimes look with envy, I guess, at places like Denmark, the Netherlands, and even closer to home, places like Cambridge, and sort of see very high levels of walking and cycling and think that there's some sort of magic in the air that has made that happen. Do you think that for the tipping point that we have to sort of build a critical mass of people participating in active travel in order for a sort of phenomenon of cultural norm to become apparent? I don't know if that's something, Sustrans, you've seen, or Eve, if it's something you've got a vision in your mind for Greater Manchester. It does feel as though, does it have to sort of build a critical mass of people?
Just very quickly, Copenhagen and Amsterdam 30, 40 years ago weren't like they are today. So the human beings 300-400 miles away, they're not a different species. Yeah. They have invested £20 per head year on year into active travel, and the behavior has changed. So we will see that. We are seeing it now with the work that's happening in Manchester, Nottingham, Birmingham. We've got a long way to go, but it's just needs the investment, and then the behavior will change. I see older people using the segregated cycle lanes in Birmingham. I see people who, more women cycling because it's safer, and all the research shows that. So, we can't just wait for this. Suddenly we're all just going to change behavior. We need a change in the environment, as well as all the supportive measures. Sorry, Fantastic
answer. That's great. End on the we need funding. Thank you, Tim. I know you've got to shoot off. Eve, did you want to come in on that?
I think Tim's response was spot on. It has to be by design. You have to design it in, but we can make those changes. We've seen, you know, just as we've seen those changes happen elsewhere, we've seen the change here in terms of from being a place where cars, you know, were rarely seen not that long ago, you know, to somewhere where they become very dominant. And the way tech has also shifted where cars go and what kind of journeys. So we basically now need to invest in the same way to reallocate space back to walking and cycling, both in terms of hard infrastructure and in terms of all those softer support measures. But I think what's right is that, as you say, when you have a growing diversity and a critical mass of people, they reflect a growing diversity of the population. And that's when it stops seeing as an in and out group, where you see it as this in group that is this homogenous group, which isn't true. When I walk out of my door now in Wally Range in Manchester, I could see a reflection of everybody of every age, every ethnicity on a bike, cycling around, but that's not currently the cultural perception of who it's for and what this is about. So we need to shape all of that, and we can.
Thank you. Well, we're out of time. That was a fascinating discussion. Thank you so much to our speakers, Aideen, Tim and Eve. I'm sure you'll join me in a virtual hand clap for them. We've posted a link to a feedback form in the chat box, so please do complete that. We welcome your thoughts about this webinar, but also all of the webinars in the series. The final webinar in this Healthy Aging Consensus Statement series is on Friday, the 25th of June, when we're going to be exploring the relationship between employment and health. And we'll have some new findings from some qualitative research that we've been doing during the pandemic. So I hope you can join us for that. Thank you again, everybody, for joining us today, and goodbye.
Thank you.